So why don't you go ahead and go first?
I'm Sierra.
Sierra?
Yes.
I'm Addison.
Addison?
Bridget.
Bridget?
Maddie.
Maddie?
Kylie.
Hey.
And then Kiara.
Kiara. All right. Well, I'm Mrs. Stewart. My first name is also Kylie, but we'll go by Mrs. Stewart here. What do you guys think about the videos? Do you have any questions about ergonomics? You guys probably haven't set the position of the chairs yet. Probably don't have a full understanding of it just yet. But with me, I've been practicing. I graduated from this program in 2008. And so I've had 11 and a half years of experience outside of school. Loops are going to be your best friend in setting the chair to the correct position. Very common things you're going to hear. You're trying to tip me out of this chair. Very common. But your body's more important, and the patient, you know, you get him back. You want to give him the best care possible. Asking them to move their head or putting a chair in a position that's going to help you, they're going to be fine with it. You're going to hear comments. You're just going to have to get used to it. Asking them to move their head for you, that's going to be really important, because most of the time you're going to get the double chin tuckers, I call them, especially little kids. They tend to tuck. So I'm constantly, you know, just resting my hand on their chin, saying, let's look up towards the ceiling. That sort of stuff's really going to help you. Have any of you messed around with the chair units yet? This is second clinic day, so you guys have you even been on the clinic before yet?
Mm-hmm.
Yeah.
Okay.
We wash our hands.
Yeah. You wash.
Yeah.
Oh yes, the good old hand washing.
Yeah.
First and foremost. Well, I work in public health, and so I worked in private practice for 9 years, and I've recently gone to public health for the last 2 years. And in a facility like that, we're required to do, I don't even know what they call it. They call it Relias training. So I have to watch videos, take a test. We have them sent to us quarterly. And hand washing is one I get to take every year. So it doesn't go away when you get out into the real world if you work in a public health facility. You guys probably haven't been fitted for loops yet. Do you even know what loops are?
Yeah.
I think it's October 4th when we get fitted.
Okay.
Mm-hmm.
Do you guys get a choice in brands, or is it just one?
No, I don't.
Picking for us.
Yeah.
Typically, I think you can pick the style.
My friend at ISU said that they got to pick the brand. And
Okay.
she told me not to pick the one that she picked. 'cause-
Okay. I will tell you from personal experience, we didn't get a choice. In my class, they had one brand. That's what we got. We didn't have a light on ours at that point in time, and I stopped using it the second I went into private practice. The second I left here, I kind of got out of the habit of using them, and like the first video, I started to get lower back pain. As soon as I went from private practice to public health, I went from seeing like 6-7 patients a day to 10, upwards 12, 15 patients a day. Very difficult patients, and I was starting to get a lot of back pain, neck pain. Heating pad and ice pad became my best friends. But I got Loops, a brand that I really like, and a light, and my back pain has almost completely gone away. So ergonomics, as silly as it seems watching some of those videos, is really important to long-term being able to practice long-term. I think the average lifespan of a dental hygiene career when I was in hygiene school was 5 years. I think it's increased to 7. I don't know what it's at now, but I can definitely see how that would happen if you don't practice what they're trying to teach you. One note that I will check on with the other ladies is I do think the chair stance has changed a little bit since this video. I think it's now recommended that you have a slight angle on your legs. You're not totally flat, but that's something that we may want to check into, because I think last thing that I read, they've changed that. So And I don't know if they have saddle chairs up there or regular chairs.
They have a couple, like one or two, but like not like.
You don't? You don't like them?
Oh no, I said they have one or two, but
I
not
was
like a lot.
Oh my goodness.
They're nice.
Unless you're gonna have children, they're the best. So, any questions? Nothing?
I don't think so.
Not yet.
I don't know what to ask yet, right? Okay. We can.